Dr. Box, thank you. Good afternoon to all who are with us today. Again, we have a full menu of updates to go over this afternoon. First, we'll hear from Dr. Box and then from our friends at the Fairbanks School of Health, Dr. Nir Menachemi and Dr. Paul Halverson, who will present the results from their third round of findings on the COVID study here in Indiana. But I also wanted to say, just as an aside here at the outset, that as Dr. Box just mentioned, we are still in quarantine. We are following Dr. Box's orders. We're doing fine. No symptoms developing for either of us. I'm learned that I'm somewhat of an impatient patient. This is one of the first times I've been pinned down, but thanks to technology and I guess coffee, December 1st will get here when it gets here, but not a day too soon. In the meantime, we'll be celebrating Thanksgiving home alone. Better safe than sorry. Maybe we'll make up for it next year with family from around the state and around the country coming in and maybe do 2 Thanksgivings next year. But that doesn't mean we're not going to be giving a lot of thanks and wishing a lot of others good health and strength and the food and clothing and shelter that they need, because we know so many folks are in need and so many are stepping up to help fill that need. This year has reminded us both of just everything that we took for granted in years past, and even the most basic things like assembling and obviously packed crowds, whether it be at church or at school or at work, at sporting events, all those traditions and annual rituals or routines that have had to be adjusted or postponed. We no longer take those things for granted, and we look forward to the day when we can see that light at the end of the tunnel, when we can get back to this next new normal, when vaccines are readily available to the masses and therapeutics. We're still practicing everything that we need to do in the meantime, but that we're going to round that fourth turn, so to speak, here in Indiana at some point. But we got to do all the necessary things to get there. So I just wanted to put an extra shout out of thanks to all those who are doing just that. I really have been encouraged lately by so many folks who are doing even more than they were doing prior, putting others above self and doing everything that they can to do individually to help slow the spread. And that means masking up and physically distancing, washing hands. You all know the drill, but can't say it or do it enough, because all those good actions add up. And I am thankful that over the last, 4 days now, we've seen our average 7-day positivity rate tick down ever so slightly. Way too early to say this is a trend, and we have a long way to go, obviously. But when you go from 12.2 to 11.8 to 11.6 to 11.4 to 11.2, I really do attribute that decline to more and more Hoosiers individually stepping forward and recognizing the stress and strain on our healthcare network, on all the doctors and nurses and assistants, on our caregivers, and really doing all we can. And that's that will continue if we continue. And we've got a long list of communities that are doing just that. But at the very same time that 7-day average positivity rate is ticking down, the number of people hospitalized continues to rise, and the number of daily hospital admissions is continuing to go up as well. And so while on one hand we see a decline, on the other we see an incline. And we've got to be able to muster the strength and the wherewithal to make sure that over the course of the next few weeks, when it's getting colder and colder and there is more travel, people are going inside, and few months before we get to that ultimate light at the end of the tunnel, that we're doing all we can to help our healthcare network and all those care workers so that they can continue to care for those who are in the greatest need. So we'll continue, my office, myself, next week, before Wednesday, 2:30, same time next week. I will be meeting with local elected officials and businesses, hospital officials. Again, we do this on a day in, day out basis, but I want to have a very organized set of data and get those updated perspectives and input from local community leaders about their status, about what they see that the state and local communities could be doing more in terms of our partnership as next week gets here. And we'll continue to make sure that we're getting our color-coded county metrics out and in place and sharing those with those local officials. Again, I've got a long list of communities with me all the time, and with every day there's another local community where the rubber meets the road that is asking us for support and for help. And so, as I mentioned last week, the Department of Homeland Security and the ATC have both been performing regularly scheduled inspections of commercial properties, et cetera. And the state fire marshal, who has a staff of 40 code inspectors, have been working with counties, with local officials, with businesses to promote those good practices and that education. The fire marshal staff has visited over 70 sites, including facilities, as I just mentioned. The state excise police have inspected more than 1,500 alcohol permitted premises. Of those 1,500, by the way, 47 were found not to be in compliance with masking or social distancing. And so we have seen through those 1,500 and only those 47, with education efforts, nearly every single one of those of the balance, that 47 balance, have come into compliance. And so this can work. It will only work if we're doing it together and sharing what works, again, individually, whether that be a person or a small town or a big city. So look for more of that type of partnership. And with that, I'll cease to drone on, and I'll turn it back over to you, Dr. Box, to introduce our guests after your full report.
Thank you, Governor. Unfortunately, we continue to see high spread of COVID-19 across our state. Our color-coded map has 17 counties this week in red, down from 21 last week. Once again, we have one county in yellow. But 74 counties are in orange at level 2.5, which indicates community spread is approaching very high level in these communities. That's very concerning, especially with Thanksgiving tomorrow. We know that many people are ignoring our pleas and the CDC's pleas to stay home and limit Thanksgiving to your immediate household. You can see that in the video images coming out of airports around the country. Based on the spikes we've seen after our holidays, I'm concerned that many of these orange counties will wind up in red in the next 2 weeks. I cannot repeat this enough. Bringing together large groups of people from outside your immediate household puts everyone at risk for COVID-19. Our hospitals are being inundated with COVID patients. There is still time to make the hard choice today so that you can enjoy many more tomorrows with your loved ones. You heard last week about the hospital surge and how it's impacting not just people with COVID, but individuals who have other conditions such as heart attacks and strokes. The number of people hospitalized with COVID or COVID-like symptoms continues to rise and was over 3,300 yesterday. Daily hospital admissions also continue to increase at a significant rate. We also, unfortunately, are seeing an increasing number of deaths, especially among residents of long-term care facilities. Yesterday, we saw the highest number of deaths reported on our dashboard, with more than 100 Hoosiers losing their lives to this virus, and another 63 deaths were reported today. Seeing these numbers is beyond heartbreaking, especially when we realize that about half of the deaths in the last week occurred among our vulnerable residents in long-term care facilities. In addition to sending the Indiana National Guard to these facilities, we've partnered with the Bowen Center to re-engage people willing to serve in our healthcare reserve workforce. The Bowen Center launched its Hoosier Healthcare Heroes Call to Action survey again on November the 13th. In just 1 week, more than 4,300 unique individuals responded to the survey. This included 752 retired healthcare professionals, 290 healthcare students, and 3,312 active healthcare practitioners. Of these, nearly 12% said they could serve full-time. The remainder indicated they could volunteer for either a partial shift per week or up to 3 shifts per week. The respondents included doctors, nurses, dentists, pharmacists, and many others. Facilities that have a staffing need will be connected with reservists to help fill those gaps. The Bowen Center will facilitate this connection. We've been able to connect these reservists with local health departments also. I have heard from several small health departments that are struggling to keep their doors open because their staff are sick or in quarantine. The Bowen Center was able to connect one department that was at risk of being down to 1 employee, with 10 reservists in their area who had expressed a willingness to help. We also announced the Student Step Up to Serve workforce last week that engages college students. As of Friday, nearly 250 college students had expressed a willingness to assist in hospitals, long-term care facilities, to assist with COVID testing or vaccine sites, and in K-12 schools and other settings. More than 19% offered to serve full-time. More than 62% offered to help 2 to 3 shifts per week. I encourage any college student who has the availability and the desire to help to sign up for the student workforce at the link that you see on the screen. We continue to experience high test volume, which is creating longer turnaround times for results. To help address this, we've distributed nearly 90,000 Bionex Now tests to 50 local health departments to help with community testing, and we're working with other local departments to help them get the authorization they need to also be able to use these tests. We will be working with local health departments that have these rapid tests to add them to our testing map so that the public knows where they're available. These tests should only be used in symptomatic individuals who are intended, and it's intended to help with community testing. They are not for use in schools, businesses, or other sites at this time, and they are not intended for redistribution to EMS or other entities. You must be symptomatic and within 7 days of onset to meet the criteria to receive these tests. These tests provide a rapid result, and a positive test in a symptomatic individual is treated the same as a positive PCR test. Having these rapid answers in symptomatic individuals allows local health departments to quickly inform the patient of the positive result and provide on-site instruction about isolation. It also allows us to jumpstart the process of notifying close contacts of their need to quarantine to prevent further spread of infection. And it helps to reduce turnaround time for results and ease the burden on labs across the country, including those here in Indiana that are stretched beyond their capacity due to the huge increase in testing. Finally, I want to provide a quick update on the status of COVID-19 vaccine. Pfizer has applied for the emergency use authorization from the FDA, and a meeting is scheduled in early December to determine whether to issue that authorization. Once that approval is issued, states have been told to be prepared to receive vaccine in as little as 48 hours. Moderna is also expected to seek its emergency use authorization soon. We are communicating this expected timing to our hospitals and frontline healthcare workers so that they will be prepared and we can prepare their staff to receive the vaccine when it arrives. For this vaccine to be effective, people will need to ensure that they get both doses in the recommended time frame of 21 or 28 days. The COVID vaccine is not like any other vaccine in that it provides a high level of protection with a single dose. The COVID vaccine does not do that. Both doses are necessary for it to be effective. So that 95% effectivity we've been talking about is only if we get that second dose. I saw a recent poll that showed that only 58% of Americans were willing to get the COVID vaccine. I want to remind any Hoosiers who might be hesitant to get the vaccine that these vaccines will not be approved for release until a thorough review of their safety at the federal and state levels is completed. Both Pfizer and Moderna vaccines are reporting side effects such as fatigue and headache, and in some cases, fever. This is normal. It does not mean that the vaccine gave you COVID. This is the normal immune response in your body to getting a vaccine. Many people experience similar symptoms after getting a flu shot or a shingles vaccine. These are temporary effects and will wear off quickly, and the benefits of the vaccine will far outweigh these side effects. The vaccine will protect Hoosiers from contracting COVID-19. It will not be a get-out-of-jail-free card. As a state, we still need to wear our masks, practice social distancing, and stay home if we're sick for the foreseeable future until we're able to vaccinate a large portion of our population, and we anticipate that that process will take many months. The vaccine is a critical tool in our efforts to resume what resembles a normal life. But in the meantime, please stay the course. Continue wearing your masks, practicing social distancing, washing your hands, staying home if you're sick, and getting tested. That's the best way to help us get to the other side of this pandemic. Now it's my pleasure to welcome back our Fairbanks group, Dr. Nir Nimakemi and Dean Halverson. Dean?
Thank you, Dr. Box. It's great to be here with you today, and I want to express our gratitude to both you and to Governor Holcomb for leading Indiana's COVID-19 response. I'm especially grateful for the fact that you have really put science and the data in front of your decision making, and that allowing that guidance to help make these critical decisions. I'm also especially proud of our partnership with the state. You know, the Fairbanks School of Public Health has only been around for about 8 years now, and our partnership is really important because our school was created with the idea of protecting and improving the health of Hoosiers, and especially as we support both our state health department and local health departments across the state. So as Dr. Box mentioned, I'm Dr. Paul Halverson, founding dean at the Fairbanks School of Public Health, proudly on the IU-PUI and the IU-Fort Wayne campuses. Since April, our team of researchers has led a statewide prevalence study to understand the spread of COVID-19 in Indiana. It's been a really complex operation that has highlighted the ability of Hoosiers to mobilize quickly and to coordinate across multiple state agencies and private organizations to support the health and well-being of everyone in our state. While several other states are developing plans for testing on this scale, Indiana remains the only state that has conducted random sample testing statewide. And it's now in 3 phases, and we're going to talk about that in just a moment. It's exciting, really, to showcase what Indiana can do. I'm pleased to introduce now my colleague, Dr. Nir Nimakemi, who has served as the lead scientist on this testing initiative. He'll present key findings from Wave 3, and I'll highlight some of the overall findings that the Indiana prevalence study has revealed and has contributed to the overall knowledge about the virus to date. Dr. Nimakemi is the Fairbanks Endowed Chair of Public and Population Health and leads our Department of Health Policy and Management. He also is a scientist at the Reagan Streif Institute and teaches at both the IU School of Business and the IU School of Medicine, in addition to his responsibilities at the Fairbanks School. Nir?
Thank you, Dr. Halverson. I wanted to remind everyone that the purpose of the Indiana Prevalence Study has always been to determine, at multiple points in time, the cumulative number of Hoosiers that have ever been infected with the coronavirus. Knowing this information tells us how much the virus has infiltrated into our state's population and can provide Governor Holcomb and Dr. Box with key information to enhance their decision-making. Now, the number of infections is not the same as the more commonly reported number of cases. As I've noted in a previous press conference, cases represent just the tip of the iceberg. As can be seen on this pyramid, infections include everyone who may be positive for the coronavirus at a given point in time. People at the bottom of the pyramid are those that are infected but probably do not know it because they have no symptoms. Right above them are people with some but very mild symptoms. As you move up the pyramid, you find infected people with more serious symptoms who seek medical care. Some of those will be hospitalized, and fewer, but notably some, will die. Cases are those who, under normal circumstances, test positive. Because testing most frequently occurs among people on the top half of the pyramid, usually in response to having serious symptoms, cases represent only a fraction of all infections. It's now clear that people on the bottom half of the pyramid are responsible for significant spread of the virus. In Wave 3, we utilized two exciting new approaches to reliably determine the number of Hoosiers that have ever been infected. Both approaches yielded similar results, and the second approach was also validated with experimental data. Therefore, despite the findings being preliminary, we are fairly confident in them. The first approach enhances our previous method of random selection and testing by adding historic testing data, including previous positive status on individuals that were randomly selected. As the pandemic has progressed and the testing availability has increased, getting sufficient participation in studies from randomly selected volunteers has been challenging, not only here in Indiana, but across the globe. By leveraging historic testing data with the help of the Indiana Management Performance Hub, we are able to get accurate counts of previous infections in our randomly selected group. Those without a previous positive test result were invited to participate in testing as before. Our second approach, which yielded very similar results that I will momentarily present, utilized unique in-the-world information generated in Wave 1 of our Indiana prevalence study. Specifically, using the random sample from April 2020, we were able to calculate the probability of death from COVID by age, which we published in a leading medical journal. Previously, determining the number of infections that resulted in death was elusive. Everyone had to rely on less reliable case counts to determine the proportion that ended in death. Luckily, Hoosiers' participation in Wave 1 of our study generated the best data of its kind, allowing us to get a reliable rate of death by age. If you recall, during Wave 1, which was in April, nursing home residents were excluded from our study because of the restrictions of residents entering and exiting such facilities. As a result, we backed out nursing home deaths from our calculations. Specifically, we had determined that among people younger than 30 years of age, one death occurs for every roughly 19,500 infections. This risk of death rapidly increases across the age groups, such that among those over 65 years, we determine that one death occurs for every 43 infections in this age group. With this information, again, only possible due to the first wave of the Indiana prevalence study, we were able to mathematically estimate the number of cumulative infections by analyzing the ages of everyone who's already died of COVID-19 in Indiana. Using this second approach, we determined that by the end of Wave 3, in the first week of October, approximately 7.8% of Hoosiers have ever been infected. There was a notably lower prevalence in the higher risk, older age groups. Given the troubling increase to newly reported deaths in the past month, we calculated the current cumulative number of infections in Indiana using the same approach. As of Friday, October 20th, less than a week ago, we believe the population prevalence was 10.6% in Indiana, with worrisome increases, especially in the oldest, most vulnerable age groups. So what does this all mean? At an almost 11% population prevalence, we are very, very far away from the approximately 70% needed to achieve herd immunity. Without a vaccine, if infections continue to rise in Indiana, so will the death toll. As you saw, yes, generally speaking, deaths are rare for people under 30 or 40. However, deaths are far more common in the older age groups. Also, we now know that, and we have evidence to suggest that an increase in infections among younger Hoosiers quickly translates into more infections and thus more deaths among older Hoosiers. This is exactly what is occurring right now to explain the increased reported deaths and the strains on our hospitals. Every Hoosier has the responsibility to protect themselves and everyone else in the community by practicing all of the proven ways to reduce the spread of the virus. In closing, if the virus continued to spread until 70% eventually got infected prior to a vaccine, an additional 13,000 Hoosiers, and that doesn't include the Hoosiers currently in nursing homes, would lose their lives. Comparatively, that's many times more deaths than has already occurred in Indiana. Pushing to achieve herd immunity without a vaccine simply risks losing many lives in and outside of nursing homes. Now, the good news is that the same exact strategies needed to prevent the loss of lives, like wearing masks and social distancing, are also the things that we can do to protect our economy. Let me turn it back to you, Dr. Halverson.
Thank you, Dr. Minikemi. Your scientific leadership has been really vital to the success of this endeavor, and I would say your persistence in the midst of trying to manage a whole lot of things. This study has been really important, and you've done great. We genuinely appreciate the strong support from each and every person who got tested. And as Dr. Minikemi mentioned, it's hard right now to find people that want to respond to the opportunity for testing. But we had so many that did, and that we're very appreciative of that response. It's clear that Hoosiers are really appreciative and want to participate to contribute to our national understanding of COVID-19. And again, we say thank you. As a result, the following is a highlight of the knowledge that we now know as a result of our testing program. First, this work was the first scientifically accurate study to determine that 40% of infected individuals are asymptomatic. That means that prior to our study, there were many people walking around without symptoms with the novel virus who were unaware that they could infect others. And this is so important now as we recognize that we have got to take precautions even if we feel fine. Our early data also suggested that the loss of taste and smell were key symptoms specific to SARS-CoV-2 infections, especially among people not otherwise getting tested. And again, that has now become a very key, these are two very key symptoms in the diagnostic workup. And as Dr. Minikemi mentioned, being able to determine the true mortality rate by age and other characteristics was the first in the this was really the first in the world finding, and that has really been important because it, just as you've heard, this important information is key to understanding so much more about the disease. And I guess it's really important to underscore the fact that as we see the mortality tables, you can see that the older you are, the more likely you are to die from this infection. That's not to scare anyone, but it's to recognize in particular that we must take extra precautions to protect our older citizens. And frankly, at over age 60, so that includes a lot of us that really need to pay attention. And that means that we need to be very vigilant, in particular around reducing exposure to the disease. That it may mean foregoing in-person church services. It may mean reducing density in crowds and in other activities. And it may also mean being very, very careful here at Thanksgiving. The Indiana prevalence study was also the first to show that cases only represent a small fraction of infections. At the time that we did our first wave, we found that 1 out of every 11 true infections were actually counted as a case, which means that, again, to use Dr. Menachemi's term, that tip of the iceberg was important to understand. The people that were our cases that we would have otherwise really only concentrated on were really just a small fraction of the people who were really infected. Also, our targeting testing efforts demonstrated a disproportionate positivity among African Americans and Hispanic individuals, which again demonstrates the health disparities within our state and in other states around the country. Lastly, in Wave 1, the study demonstrated that public health measures worked effectively to keep infections at bay within Indiana communities. And that's so important because there is hope, and we have good reason to be hopeful now with the vaccine on the horizon. Now is the time to double down in terms of our precautionary measures, the public health measures that Dr. Box mentioned. When I reflect on the groundbreaking and enduring contributions Indiana has made to the fight against COVID-19 throughout this study, I'm proud to call myself a Hoosier, and I hope you are too. Given everything we've learned, it is imperative that we continue wearing masks, physically distancing ourselves from others, and washing our hands for 20 or more seconds. And again, as we look forward to vaccine and a healthier and more normal 2021, let's remember that, again, this message that Dr. Box gave is so important, especially around Thanksgiving. Just because you have a genetic connection with your family, and I know this is a little counterintuitive, but because we like to think of if we're part of the same family, we can share the germs, everybody will be protected. But the reality is, just because you have a genetic connection does not mean that if you're not in the immediate household that you can relax and not wear a mask. You need to be sure that we are isolating appropriately, trying to reduce that exposure. Be careful. We're worried about this holiday. I think all of us in public health in particular are worried about this holiday. Let's get through this one so that we can celebrate really the Thanksgiving of getting through COVID-19. And again, our hope, Governor and Dr. Box, is that our study has been helpful to you as you lead our state through this important public health crisis. Thank you, and back to you, Dr. Box.
Thank you, Dean Halverson and Dr. Nemechemi. Such important words of wisdom, and I'm so glad that you'll be able to stay on with us in case during our question and answer time they have questions for you. Rachel?
Hakeem Shabazz, Indy Politics.
Early Thanksgiving. Two questions real quickly. Dr. Box, from you, is there any data out there on once someone contracts COVID-19, how long they have it before, say, some of the symptoms tend to go away or disappear? And for you, Governor, Representative Stutzman penned a letter, was on Facebook, saying why she was stepping down, very critical of your administration, stay-at-home orders. Any sort of reaction to that?
So I'll go ahead and start, Governor. So, most people, if they are going to become symptomatic, will start to see symptoms between days 5 to 7. But as you know, Abdul, many people are asymptomatic with this, especially our younger population. So if you look at the entire population, maybe 40 to 45% of us never really develop symptoms, and our even younger population, that may be quite a bit higher, 60, 70, and even higher than that. So really it's the reason we have such a difficult time controlling this disease.
Yeah, and my only reaction, Abdul, is good morning to you, whatever time zone you're in or whatever exotic place you find yourselves in celebrating this Thanksgiving. Afternoon here. In reaction to your question, I would say that I only wish her and her family well. So many. She points to a very important topic, and that is that so many individuals and so many businesses have had to adjust and make changes to safely deal with the reality of this uber contagious, easily transmitted virus, this pandemic that's unprecedented in all of our lifetimes, and making sure that we're all doing everything that we can, not just to save lives and care for those who are in need of it, but also make sure that our healthcare network isn't strained beyond the ability to care for our neighbors. And it's just on the flip side of the coin, beyond inspiring to see all the small, medium, large Hoosier businesses that have become very creative, safety first, paramount, but become very creative in negotiating their way through this pandemic. And we will continue to not just be in contact, but rely on information from businesses all over the state of Indiana in every sector. And while it's encouraging to see some sectors actually having a better year than this year than they did last, as hard as that is to kind of wrap your brain around, others are hurting, and especially our hospitality industry. And there's nothing more than I'd like to have, massive conventions back and air travel back. That day will get here, and has been mentioned already a few times. When we get to that point, when we have vaccines, when we're down to a responsible level, and those packed gyms and packed churches become safe to do, all that hysteria that comes with it, that I look forward to that day. But until then, we have to be informed, and then we have to act on that information.
Meredith with WLFI.
Hello, Meredith.
Hi, good afternoon, Governor. Good afternoon, Dr. Box. So my question is concerning the 47 businesses that were not found to be in compliance. Was there any area in the state that was found to be more of like a problem area than any other parts of the state? And how were those businesses reprimanded, or were they reprimanded? And how are you making sure that they're continuing to now follow compliance now that they've already been warned, I guess, at least once?
Yeah, no, not to, and I don't know if Joe Herons is on deck here. We do have, I don't think Steve Cox, I think he is out in the field actually as we speak. But no one area stood out, but we have still, and Meredith, taken been in the posture of education and helping, and then working at making sure that the local, not just health department knows, but is taking the lead locally as well. Joe, if you're available, feel free to chime in. If not, we can get Meredith a breakout for you on those 47 of the 1,500 where they are, so you've got a kind of a pin in the map and see what the follow-up is. But it's all been local, and like I said, and what's been shared with me is most have been appreciative of, oh, that's how we can do it. And that's why I just, again, want to applaud so many local efforts, not just as of late, but they're starting to accumulate. And that's going to make a big difference across the whole state of Indiana, not just putting a blanket or having a blanket reaction, but looking at this regionally, county by county and regionally. And when we see Marion County and Allen County and St. Joe County thinking regionally, Elkhart, Monroe County, Vigo County, Hamilton County, Fishers, Petersburg, Marshall County, Tippecanoe County, West Lafayette, Lake Station, Huntington, Howard County, Clark County, Floyd County, Whitley County, Davies County, DeKalb County, Valparaiso. I mean, the list just goes on and on and on. And these are all folks that are stepping up, not just in capacity, but in different efforts, communication. We've been in very close communication, regular, with AIM and with AIC, with our counties and our city sister organizations. And we'll be continuing to step up. And that's why we carved out that $20 million to help with educational efforts on the ground. That's what's going to make a difference, not just in the state of Indiana, but I think that's what's going to make a difference across the country.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. Afternoon, Dr. Box. I have a question for you, Governor, and then a question for Dr. Box. First to you, Governor. What is the status of the $20 million, I think it was, that you're sending to local communities to help with this education effort around COVID-19? Have those funds been sent out yet? What's the status there?
Yeah. We put together the program, as you allude to, communication about that program went out to all of the counties last week, formally on Friday, to all the cities and towns. The IFA, the Indiana Finance Authority website has been updated, so they're ready to receive all those grant requests. And we did clarify, I think there was a couple questions about was Marion County included in that as well. And yes, the answer is yes, they are. So we'll process as we receive.
And then Dr. Box, you talked already about how worried you are about a spike related to Thanksgiving, because we see a lot of people just ignoring all of the advice. What advice do you have for communities and healthcare systems who are sort of bracing for this surge amidst this already ongoing surge?
So our healthcare systems are doing an amazing job across the state of Indiana. They are partnering and collaborating with the state and with each other within their regions. And I think that is what we're going to have to continue to do. We're going to have them reach out when they need something, if they need to transfer patients, if they need more ventilators, if they do need more staff. We need to be there to try to help answer the calls that they have. And I think that our hospital system is incredibly well positioned to do that. They have been amazing partners from the very beginning of this pandemic with us.
Abigail with the Brown County Democrat.
Afternoon, Abigail.
Good afternoon. Good afternoon, Governor, Dr. Box, and happy Thanksgiving to both of you. I have two questions, and I think they're probably both for Dr. Box. My first question is, which days' data were used to inform the decision to change counties' color statuses today? We see that for Brown County, test results for November 19th to 24th are marked preliminary, and we know that recently test results were taking as long as a week to come back for people here. And do we have a full week's worth of data to accurately judge our level of spread?
So we use the data as of midnight on Sunday night. So it is a full 7 days of data, and whatever data has come in that time frame with regards to tests. So yes, if those tests lagged, if there was a 5-day wait or a 7-day wait for that to come through, then that has lagged a little bit there. We are seeing Optum turnaround times improving and working very hard to make sure that that's the case also with our local health department turnaround time. We don't have a lot of control over the national labs, but we are truly redistributing labs across the state of Indiana, have looked and sent labs to an external lab in another state, and are continuing to investigate every possibility. I think the use of the point of care tests with the BioNex Now cards also at our local health department testing sites not only gives individuals an immediate response to you're symptomatic and boom, your test is positive. So you need to isolate, and we need to know who your close contacts are, and here's the information for them. But it also helps to take the burden off of our labs or to decrease that burden.
Pierce with ABC 57.
Good afternoon.
Good afternoon, Governor. It's actually Brian Coneybear at ABC 57. Pierce is my producer. Back to State Representative Christy Stutzman, who just announced her resignation because of she says, coronavirus restrictions on businesses. She runs the Barns at Napanee, which is a restaurant and entertainment venue, and she says it's been so difficult to run that business that she's had to do more work there and take on more responsibilities there, so she cannot be a full-time state legislator as well. And she says there was no input or approval from state lawmakers on these COVID restrictions, that they were your unilateral decisions. What's your response to that?
I'll let her speak for herself.
But you will not respond to that. You do not run these kind of things by any state lawmakers. It is your decision to put in the restrictions along with the health department?
Well, ultimately, it's my responsibility, and it's, as I said earlier, we are informed by multiple sources, including physicians, epidemiologists, scientists, business owners, various sectors, legislators, leadership. And I checked in with leadership on a regular basis over the last, months, asking if there was any appetite whatsoever for a special session, and there was none. And so I am seeking to continue to be collaborative. Ultimately, in a public health emergency, and with whether it's funding or agency decisions, that is, the buck stops on my desk, and that's my responsibility. And we can debate it, and we can certainly and will continue to. I'll be doing more. Did a lot of meetings this week, and we'll be doing, as I mentioned, next week. We are informed businesses in northern, central, and southern Indiana, small, medium, and large, with organizations, with local officials. And so, I would have welcomed her input and still would. But I can't pretend to understand all the intricacies of that business or the projected blame on any one individual. We're living through a public health emergency, and we've got to rely on one another to get through it.
Carly with WPTA.
Good afternoon.
Hello. Yeah, my question is just county and local health officials to make changes and restrictions. What types of things would you maybe recommend county by county be doing right now?
Well, and Dr. Box, you might want to talk a little bit about kind of the local Department of Health office and how we're working with them to make sure that they have the information. I mentioned capacity limits. And again, this has to be tailored toward each locality and what they're experiencing and what the testing and the tracing. And as we get more and more positive cases, tracing gets harder and harder and harder. Maybe Dr. Box, you can talk about that a little bit as well. But each local community, whether it be a mayor that we're talking to all over the state of Indiana, one might say, we're having issues with in-person church services. One might say we were having issues with sports gatherings. And so they addressed those origins of the spread. And that's what I would recommend as we become informed about where this is occurring, addressing those issues. And if it's bars or if it's gyms or if it's a curfew or if it's capacity, if it's there's a whole long list of different approaches according to what's going on in that local community. And so that's why we've taken this approach of how do we work with our local government and local elected officials to weather the storm. Dr. Box, anything to add to that? Or
I would only add that I think that we had several phone calls this week with not only the local public health individuals and the hospital representation, chief medical officers, CNOs, and also CEOs, but we also included elected officials from those areas. And it was a really good forum for elected officials to hear the struggles that their hospitals in their region were having, and the difficulty in being able to make sure that they could give optimal care to every patient that came through their doors. And so those kinds of things like, as you mentioned, Governor, putting a curfew potentially on the area, or making sure that individuals are understanding that, you could put a sign on your door and should put a sign on your door that says no shirt, no shoes, and no masks, no service. We all got used to the no shirt and no shoes. There's no reason we can't get used to the no mask. and encouraging them to make sure that if individuals want to come in and get service, this is what it's going to require. And if individuals are not able physically to wear a mask, then there's home delivery for pretty much anything that you want to get these days, and how we can help individuals do that. So we just go through bit by bit what those recommendations are, and they pick and choose the ones that work the best for their communities.
Yeah, and I would say, just if I could, Rachel, before we move on, what we're trying to do again is avoid, with the stress and the strain of our healthcare network, we want to make sure folks are informed and they realize just what we might have to give up in terms of potentially elective procedures or in a community, because it's been the case where I've just experienced this personally, where people say, well, I didn't know how stressed our local hospital was, but it does make a difference when you see the positivity rate, when you see the spread, when you see the hospitalizations in your local community, and you start to realize, a cancer patient or an elective procedure might be put on hold if we continue on this trajectory. And so that's what we're trying to prevent. And right now we're being reactive because we're at 12-11% positivity rate. We got to get back down toward that 5% and then get to some months down. We look at this in a very short-term and long-term simultaneous way, and that is short-term, daily, weekly, and a month, and then long-term we're looking at 1 month, 3 months, 6 months. And we can see, again, I want to give people hope going into Thanksgiving that we will come around turn 4, and there will be therapeutics and vaccines available, multiple. And we've got the plan, as you've heard Dr. Weaver in the past and Dr. Box talk about today, deploy those. But until that time, and then through it, we're going to have to practice these, as Dean Halverson said, precautionary measures.
And I think, Governor, the point you made is really important, and that is that we can be very thankful that we do have vaccines that are showing this kind of efficacy and this kind of safety with no major complications. We could right now be having a group of vaccines coming back showing that they really didn't work. We had no idea, and that there are major complications or side effects with it. So I feel very blessed and very thankful that this year we do have that light at the end of the tunnel, but we've got to get past this burden right now and these high number of cases that we have. And the only way we're going to do that is if we start following these mitigation measures.
Bob with WTHR.
Afternoon, Bob.
Good afternoon, Governor and Dr. Box. Governor, I'm very pleased that you and Mrs. Holcomb are continuing to feel well. So thank you for taking my questions.
Ready for me to get back to work.
I want to make sure you have a little bit of background for my questions here today. This week, 13 News reported the number of backlogged and pending unemployment claims in Indiana had grown to more than 1.2 million claims by the start of this month, which is a significant increase from the backlog just a couple of months earlier. And I've received hundreds of desperate messages from Hoosiers waiting for their unemployment, many of whose claims have been delayed and pending for 4, 5, 6, 7 months or more. And a contracted worker who talked to these people every day when they call the Department of Workforce Development call center helpline says that the Department of Workforce Development won't allow the contracted workers to resolve simple issues that could help relieve the backlog of cases. And the whistleblower says that those contracted workers who the state has paid $15 million to over the past 6 months, and I quote, really cannot help anybody at all because we are not allowed to. So I actually have a couple of questions for you about that. One is, what concrete steps, if any, are being taken to help alleviate the large backlog of pending unemployment cases that the state's facing right now? Second, will the state be shifting any resources so that the 300 contracted workers at Navient who answer the phones might instead actually be able to have the authority and training they need to resolve pending claims? And third, the state just extended Navient's contract for an additional year and $8.5 million when it appears that the contractors answering the unemployment helpline really can't provide much help. And I'm wondering why the state chose to do that.
Yeah. Fred Payne, I think you're at the ready. Would you please, you got all three of those questions, but will you please articulate or share just exactly the job descriptions and what Navient has been hired to do, how they're doing it, and then how the agency itself, adjudicators, et cetera, are following up, which are two different tasks. And then maybe you could, Fred, also add, not as an excuse, but as part of the education, your efforts to make sure that fraud isn't overtaking tax dollars as well.
Yes, Governor, thanks. And I think the question, understanding the question, I'll just start off by saying Navient was hired to help with an unprecedented volume of claimants navigate the unemployment system through our call center. The Navient contact center agents have provided significant help to hundreds of thousands of Hoosiers. And we are very appreciative of the work that they performed and the dedication that they've shown as contract employees doing that work. But Navient is only a portion of the DWD's efforts to meet the needs of claimants during this pandemic. We significantly increased the staff across the UI program. The role Navient played has been designed based on, in part, federal law and the complexity of the system and the time constraints of the pandemic. Their work has been adjusted as appropriate in our system. And the work at the call center that the people are doing is helping folks every day. But they're not all engaged in claims investigation work. That's not what they were all hired to do. Some do help on specific issues that are outside of customer service calls. But keep in mind, claims investigation work requires significantly more training than could be accomplished in a short period of time. So we do have the ability, and we do continue to move resources around to meet the demands and to meet the needs. Now, in terms of the number of claimants who are continuing to wait on claims that go beyond 21 days, first I'll say that, again, as we said from the beginning, every eligible Hoosier who files for unemployment insurance benefits will be paid their benefits. We've not wavered from that. We have had more than about 905,000 Hoosiers to request benefit payments. We have paid over 736,000 of those Hoosiers to the tune of about $6 billion in benefits. Now, the individuals who at this point are waiting payment, there are a variety of reasons for that. Now, some of those in that number will include those who've just filed for this week. But they're waiting because of standard claims adjuster issues, just some standard issues. Some of them are going to be denied. Not every individual who requests payment is eligible for payments. But then I'll also talk a little bit about the massive amount of fraud. If we ended up having a system that paid quickly and that we didn't require individuals to jump through a few steps, then fraud would overtake our system. And right now, I think everyone is aware of the amount of fraud that's occurring in the United States right now. Indiana is not one of the states, or is not a state that's left out of that mix. So we're dealing with a lot of the fraud. And we've put in a lot of measures to address fraud. Now, does that slow down our payment process? Absolutely. We want to make sure that we are providing eligible Hoosiers the payments, and we're not getting the information or getting payments out to those who don't deserve it. So we're continuing to work through that, and we are adjusting every week. When we end up seeing some of the downstream impact of some of the new new processes that we had to put in place or new programs that we had to put in place. As you recall, when we put those new programs in place, we did them pretty quickly. We did them in a matter of days and weeks, not months and years. And when you're doing that, sometimes the troubleshooting that would necessarily be in place, if you had months and a year to put those things in place, you can do those. So we do find from time to time that there are some downstream impact of troubleshooting that we have to adjust to. And we're doing that on a constant and a consistent basis. But I want to make sure that I do confirm that we are still paying Hoosiers at a rate of about 80 to 85% of those who file claims within 21 days. Our claims that go beyond 21 days, it's not in the millions. That is not accurate.
Thanks, Fred.
That concludes today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.